let's go to the thing that I said, we don't like to talk about on the show. It's 2024, and of all the topics that have become, we don't talk about this on the Elias Macko show, it's COVID, right? It's 2024. Pandemic is over on this program. It's done. I know some people disagree with that.
This pandemic has sucked.
That's right. Thank you, Prime Minister. It sucked, and now I moved on, okay? But there was a report that came out this week from the Global Data Vaccine Network. It got a lot of press. It got a lot of headlines, and it got my attention. And it reveals a link between the COVID-19 vaccine and certain health issues people have experienced after getting that shot. However, the report says people should still continue to get the vaccine. So I said, we have to talk about it, because anything that gets headlines like this needs to be looked at. Dr. Christopher Labos is with us, cardiologist with a degree in epidemiology. He's on the line. Hi, Dr. Labos.
Hello.
I'm breaking the rule to talk to you about this. I saw the headlines, and boy, they seemed pretty worrisome, because I've had so many of these shots and boosters. So what do we need to know on the headlines and this study report?
Well, to some degree, this study report didn't actually provide any new information. What this report was, this is sort of a network of different researchers across many different countries, and they sort of pooled their data sources to look at the side effects of the various COVID-19 vaccines, not just the mRNA vaccines from Pfizer and Moderna, but also the AstraZeneca vaccine as well. And what they found was that the main side effect associated with the AstraZeneca vaccine was those blood clots in the brain. For people who remember this, we're at the beginning of the vaccine rollout, the sinus venous thrombosis, which is the reason why we actually stopped using the AstraZeneca vaccine, at least here in Canada. And then other complications with the mRNA vaccine, like myocarditis. So in some respects, they are really just reiterating what has previously been known about vaccine side effects and just sort of formalizing in their data set what has been seen by the CDC and Health Canada and most countries around the world.
And of course, it's not lost on me. Okay, the risk from vaccine. I think if we talk about those risks without talking about the risks of actual COVID, then we're not doing a service here. So what it's one thing if you've got these links with the vaccine, but we have to not forget getting full-blown COVID also presents risks, doesn't it?
Well, yes. And I mean, I see a lot of patients who have the consequences of COVID, and it is very, very problematic. I see a lot of people who, after they get a COVID infection, their blood pressure is out of control for a period of time. They have more arrhythmias. They have obviously the respiratory symptoms of fatigue. And even when you take something like myocarditis, which really dominated the conversation around vaccines, especially amongst young people, the risk of myocarditis with COVID is worse. And what's interesting about this particular study, the way they did their analysis, they looked at the expected rates of myocarditis versus the observed rates of myocarditis and all the other side effects. Well, the observed rates of myocarditis, they did their best to try to limit it to the post-vaccine side effects, but at least some of that was probably residuals from COVID as well. And so it's very hard to tease out when you say there's been an increase in myocarditis, how much of that was due from COVID and how much of that was due from the vaccines. Frankly, a good portion of that probably was due from COVID, because we have seen COVID damage people's hearts, and that's been a very well-documented complication as well.
In the minute we have left, I guess the real question that I have is, it seems like what's done is done. We had the pandemic. COVID is still around. We've gotten boosters and shots, right? Is there anything right now where we still need to change our life, where we still need to avoid things, or have we reached the point for most people that you're either going to get COVID, you're going to get vaccines and get boosters every couple of years or every year, depending on what your decisions are, and we should just move on? What are your thoughts?
Well, the one thing that we're really not talking about that we probably should be talking about is indoor air quality. I mean, we haven't actually fixed a lot of the infrastructure problems that we had in schools and all that, where air quality was actually quite poor. And so if we want to prevent COVID influenza infections, what we actually have to do is start looking at the ventilation status of our public buildings, schools, workplaces, and all that. Because if you can improve indoor air quality, ventilation, and filtration, you will have less COVID and less influenza too. And that's the thing that, for whatever reason, people don't really want to talk about, because I think it's a lot more complicated to talk about than a vaccine rollout, which is relatively more simple.
And you think about the payoff if you have better air quality, and that leads to less people going to an emergency room for the flu or COVID or whatever it is.
Exactly.
Dr. Labos, our listeners will catch you on Sunday mornings with Weekends with Ken at 8:10. Thanks so much.
Thank you.